Dear Dr. Abby, what is shingles and how is it treated? I'm Harvard dermatologist, Dr. Abby Waldman. Let's get to it. You may remember getting chickenpox when you're younger. If those of you who are not an elder millennial, you didn't get chickenpox, you actually got vaccinated against chickenpox, assuming you got vaccinated. That virus, that chickenpox virus, is called varicella. After you've had the chickenpox, virus goes and it sleeps in your nerve. It just goes to sleep. It's there, but you don't know that it's there. It's not causing any problems, but then sometimes there's a trigger, either a stress or an infection or something that kind of triggers that varicella virus to wake up. And when it wakes up, it doesn't typically go everywhere like when you had chickenpox. It wakes up just along the nerve that it was sleeping in and shows up as little blisters, but just in like one area. So when our sensory nerves are kind of strips, so you have one that does like your whole forehead and your nose, you have one that kind of does the center part of your face, the lower part of your face, and then like each strip of your skin is fed by one sensory nerve that kind of goes out starting in the middle and going in one direction. So that's a key that you have zoster in that it typically doesn't cross the midline. It's going to go in that one nerve and kind of go along that whole strip. Other signs of zoster are that it's painful or itching. Key to get treated really early as soon as you have symptoms, because that can actually decrease the long-term effects you can have or any complications you can have from having zoster. So oftentimes, even once the zoster goes back to sleep and all the blisters are healed up, you can have what's called postherpetic neuralgia, which is like a burning and stinging along that line that you had the zoster. Other complications that can happen is that if that nerve feeds some critical organ, such as your eye, that you can get an infection inside the eye and that can cause some permanent vision effects. Key is if you have zoster that's on the forehead and is going down to the nose, especially when it's on the tip of the nose. The tip of the nose is a bad sign, a warning sign that the nerve that innervates the eye may also be involved. You need to seek treatment right away in order to protect your vision. Typical treatments are antivirals, usually a short course of antivirals. If the zoster has been going on for a long time, oftentimes those antivirals are no longer going to be particularly effective. Hence the reason for getting treatment really early.